Hi everyone. In this class we are going to see about osteoporosis. Osteoporosis is a debilitating disease that affects many older people. Yes, it is a global public health problem that affects mostly the older people. Osteoporosis means, osteo means bone. Porosis is nothing but the whole formation in the bone. Yes, that is osteoporosis means that is the porous structure or the whole formation which is present in the bone. The definition of osteoporosis is it is a systemic skeletal disease characterized by low bone mass and microarchitectural deterioration of bone tissue with a consequent increase in bone fragility and susceptibility to fracture. WHO defined the definition of osteoporosis, which is a systemic skeletal disease. Yes, osteoporosis is a skeletal disease which is characterized by low bone mass. Because of the low bone mineral density, osteoporosis will occur, and microarchitectural deterioration of bone tissue. At the same time, it increases the bone fragility and lead to susceptibility and lead to fracture. Yes. The purpose of clinical diagnosis, at least for women, the WHO defined osteoporosis according to the bone mass. Fragility fracture are the hallmark of osteoporosis and are particularly, these are common in spine, hip and distal forearm. So apart from these three parts, it may occur throughout the skeleton. You can see the picture of normal bone as well as the osteoporotic bone. In this picture, in the normal bone, you can see the bone density. Here in the osteoporotic bone, you can see the low bone mineral density, isn't it? Here the thicker bone is there and here it is very thinner. In this picture, this is a normal hip bone. This one is osteoporotic hip bone. In the normal hip bone, this cortical bone, this is a thicker cortical bone. In the normal hip bone, you can see the thicker cortical bone. You can see the thickness of the cortical bone here. In this osteoporotic hip bone, you can see the thinner cortical bone. If you compare these two pictures, you can see the thickness of the cortical bone, and here you can see the fewer and thinner trabecular bone. Yes, but in this picture, thicker bone is there. Here it is fewer and thinner. So this is a difference between the normal bone as well as the osteoporotic bone. Here you can see this is the early stage of the disease osteoporosis. Here it is later stage of osteoporosis. In here, this cartilage is the normal one. The normal, you can see the normal cartilage portion. Here you can see the cartilage particle, which is because of the loss of cartilage. Yes, because of the degeneration of cartilage, you can see the cartilage particles in between there. That is the loss of cartilage. This is because of bony hypertrophy. In this, the risk factors of osteoporosis. Low bone mineral mass is one of the main factors. Yes, the main factor of osteoporosis is low bone mineral density. This low bone mass in later life depends upon two factors. The first one is the peak bone mass, which is achieved during the growth period, and the second one is bone loss, that is the bone loss rate at the time of later part. So this bone mass in later life depends upon peak bone mass which is achieved during the growth period and the rate of age related bone loss. So development of maximal bone mass during the growth and reduction of bone loss later in life are two main strategies of preventing osteoporosis. So these are the two main strategies. What are they? Development of maximal bone mass during the growth period. Yes, at the time of growth period, we have to develop the maximal bone loss. The second thing is the reduction of bone loss in the later period. In the later part, the second thing is the reduction of bone loss. Yes, these are the two main strategies for preventing osteoporosis. So consequently, any other factor that influence the development of peak bone mass or the loss of bone in middle age will affect the later fracture risk. Yes. So the development of peak bone mass and the loss of bone. Yes. That is, these are the two factors which we have to consider mainly. Factors which influence bone mass. Factors can be broadly grouped into two, that is, factors that can be modified and factors that cannot be modified. Gender, age, body size, genetics and ethnicity, these are the factors which cannot be modified. We can't modify the gender, we can't modify the age or body frame like that. So these are the factors which cannot be modified, but some of the factors we can be modified. In that, it includes hormonal status, lifestyle factors, it including physical activity level and smoking and alcohol consumption pattern, and the diet, and the healthy diet particularly. So these are the factors which can be modified. So the interaction of these genetic, hormonal, environmental and nutritional factors influence both the development of bone to peak bone mass at maturity and its subsequent loss. So these are the main factors which are very important, right? The next we are going to see about some of the nutrients which helps for the better bone health. So in that we are going to see about calcium, vitamin D and protein. Yes, first one is calcium. Calcium is required for the normal growth and development of the skeleton. Especially for the bone health, we have to take more amount of calcium in the diet. If you take adequate intake of calcium, definitely can achieve the optimal peak bone mass and modifies the rate of bone loss associated with aging. So if you take adequate amount of calcium in the diet, definitely we can attain the peak bone mass and we can modify the rate of bone loss. So enjoying a healthy and balanced diet with a variety of foods, which includes variety of fruits and vegetables and other food items with adequate intake of calcium, it's a important step to building and maintaining the healthy bone. Yes. So if there is not enough calcium is present in blood, our body will take the calcium from the bone. So automatically demineralization will be there. So because of the demineralization, what will happen? Low bone mineral density or low bone mass is there. So it leads to osteoporosis. So for that we have to take more amount of calcium rich foods. Some of the foods which are rich in calcium are milk products like yogurt, cheese, soybean, turnip, greens, lady's finger, orange, sesame seeds, almonds, cinnamon, then green beans, pumpkin seeds, spinach, orange juice, cabbage, then pirandai, gingerly seeds, agatti. These are some of the foods which are rich in calcium. Next is the relationship between vitamin D and osteoporosis. Yes, vitamin D is very important for the absorption of calcium. Yes, vitamin D and calcium promote bone density. Yes, of course, for the better absorption of calcium, vitamin D is very important. We obtain most of the vitamin D from the sunlight. So sunlight is the best source of vitamin D, but there are recommendations of safe sun exposure. That is, for that we have to depend on our skin type, geographical location and the season. So these three things are very important for the safe sun exposure. Vitamin D, apart from sunlight, vitamin D can also found in small quantities in the food such as fatty foods like salmon, herring, mackerel, liver, eggs, fortified foods like low-fat milk and milk products and margarine. These are the foods which are rich in vitamin D. Eggs, cheese, sunlight, fortified foods, mushroom, salmon. So vitamin D, the body makes the vitamin D when it exposed to ultraviolet rays from the sun. Yes, these are some more food items like cheese, margarine, butter, fortified milk, healthy cereals and fatty foods. Next is about protein. So protein is the next most important nutrient for bone health. So good sources of protein are meat, poultry, fish, the nuts and oil seeds, of course dairy products, milk and other milk products which are rich in protein as well as calcium, dry beans, peas, then egg. So both low and high intake of protein rich diet. So protein diet can affect the body's ability to use the calcium. So eating protein in moderation is better. So high protein diet or low protein diet, both the cases can affect the body's ability to use the calcium. So moderation of protein intake is very, very important. So for the better absorption of calcium, vitamin D is very important. Along with that, protein is also important for the better bone health. So calcium, protein, vitamin D, these are the three things which are important for the healthy bone. So apart from that also, we have lots of nutrients which helps to maintain the bone health and which helps to increase the bone mineral density. That nutrients I will discuss about those nutrients in the next class. Okay. Thank you, girls.